Welcome to my channel. In this video I am going to discuss about the fetal circulation. Before we knowing about the fetal circulation, we have to know about the adult blood circulation. Okay, I am little bit explain about the adult heart circulation. Here you can see clearly about the right heart, that means right atrium and the right ventricle, left heart which contains a left atrium, left ventricle and the aorta and the pulmonary artery. This is the basic thing. We get a blood from the superior vena cava and inferior vena cava to the right atrium. From the right atrium, it pushes the blood to the right ventricle through the tricuspid valve. From the right ventricle, it pumps the blood to the lungs through right and left pulmonary artery. Okay, and from the pulmonary artery send the deoxygenated blood to the lungs, and oxygenated blood carries through the pulmonary veins. Here you can clearly see the four pulmonary veins. Here two right pulmonary veins, two left pulmonary veins. Totally four pulmonary veins carries the oxygenated blood from the lungs. From the pulmonary vein, it pours the blood to the left atrium. From the left atrium, it pushes the blood to the left ventricle through the bicuspid valve. From the left ventricle, it pushes the blood to the aorta and it sends the blood to the systemic circulation. Okay, this is the basic anatomy of adult circulation. If we know about the basic anatomy and the circulation of the adult, then only we know about the fetal circulation. Okay, now I am going to explain about the fetal circulation. Here you can clearly see about it. In fetal circulation, it's just a simple flow chart. I am going to explain in the picture also. First we have to know about the fetal circulation in the flow chart. This is enough to write in the your university exam also. Okay, we already know fetus get a nutrition, oxygen and blood from the maternal, okay, through placenta. The placenta which contains the umbilical cord. It is the connection between the mother and fetus. The umbilical cord contains one umbilical vein and two umbilical artery. The umbilical vein is carried oxygenated blood and the umbilical artery carries deoxygenated blood. Okay, we have to know about it. Umbilical vein carry oxygenated blood, umbilical artery which carries deoxygenated blood from the fetus and send it to the mother to get oxygen. Okay, here umbilical vein carry oxygenated blood. Thus umbilical vein directly send the blood to the ductus venous which is present in the liver, and it bypass and enter into the inferior vena cava through the ductus venous. Okay, and also inferior vena cava get blood from liver and lower limb and mainly lower part of the fetus. From the lower part of the fetus, it is the deoxygenated blood. From the ductus venous, it is the oxygenated blood which has directly enter into the inferior vena cava. So the inferior vena cava contains both oxygenated blood and deoxygenated blood. Okay, that means if it is oxygenated blood, it passes through medial to the inferior vena cava. If it is deoxygenated blood, it passes lateral wall of the inferior vena cava. Okay. We already seen in the adult circulation, the inferior vena cava and superior vena cava directly pour the blood into the right atrium. As well as here also, the inferior vena cava send the blood into the right atrium. In adult, it right atrium, right ventricle. Okay, but here it's directly enter the blood from the right atrium to the left atrium through the foramen ovale. That means there is a interatrial septum, interatrial connection between the two atrium, that through the foramen ovale. We have to know about the foramen ovale. We already seen ductus venous and also foramen ovale here. It bypasses through ductus venus and it bypasses to foramen ovale. Okay, from the left atrium it enters into the blood to left ventricle. From the left ventricle to the aorta, and blood enters into the systemic circulation. Okay, and it fully oxygen transfers to the fetus tissue and get a deoxygenated blood from umbilical artery. So umbilical artery carries a deoxygenated blood and it again passes to umbilical cord. Umbilical cord, this contains umbilical vein and umbilical artery also, and it then passes blood to the placenta, and from the placenta the deoxygenated blood enter into the maternal blood circulation. Okay, this is the basic anatomy. From the left atrium to the systemic circulation, it is the same as well as in adult circulation. Here right atrium also carry oxygenated and deoxygenated blood also. We have already seen here inferior vena cava contains both oxygenated and deoxygenated. The deoxygenated blood little bit enter into the right ventricle also. From the right ventricle, we already seen in the adult circulation as well as here also, right ventricle send the blood into the pulmonary artery to get oxygen from the lungs. But fetus, there is an absence of action of the lungs. The only activation of the lungs after the delivery only. So here the lung is inactive. Lung inactivation leads to a small amount of blood enter into the pulmonary artery. That means 20% of amount enter into the lung. From the lung, the pulmonary vein enter into the left atrium. Okay, and pulmonary there is a connection between the pulmonary artery and aorta. I'm going to show in the picture also. Wait for it. There is a connection between the pulmonary artery and aorta, that is called ductus arteriosus. Okay, it bypass, and that means it carry also blood to the right ventricle. From the right ventricle, it push the blood to the pulmonary artery. But 20% of blood only enter into the lung. But most of 80% of blood enter into the directly aorta through the ductus arteriosus. That means the connection between the aorta and pulmonary artery. Okay, here I am going to show in the picture format. Here you can clearly see about it. First, this is the placenta and it contains umbilical cord which carries one umbilical vein and two umbilical artery. Okay, from the umbilical vein it carries oxygenated blood. It enter into the inferior vena cava to bypass through the ductus venus which is present in the liver, and also it carry a deoxygenated blood from the lower limb. Inferior vena cava push the blood into the right atrium, and there is a connection, abnormal connection, that is the normal connection in the fetus. Okay, normal connection in the fetus, that is a foramen ovale which is the interatrial septum that connects the right atrium and left atrium. Okay, it passes the blood to right to left. From the right atrium, it enters the blood into the left ventricle. From the left ventricle, it blood pushed to the aorta and enter into the fetal systemic circulation. Okay, this is the normal thing, and some amount of blood also enter into the right ventricle. From the right ventricle, blood passes into the right and left pulmonary artery, which is 20% only enter into the lung. Otherwise 80% of blood enter into the systemic circulation. That means enter into the aorta and then systemic circulation. That's how means. Here you can clearly see This is the right and left pulmonary artery, and this is the aorta. Here you can clearly see the connection between the pulmonary artery and aorta, that is called ductus arteriosus. Okay, here ductus venosus and foramen ovale and ductus arteriosus, and blood enter into the systemic circulation, and the tissues are get oxygenated, and deoxygenated blood enter into the umbilical artery through the internal iliac artery, and the internal iliac artery which it carries hypogastric artery. From the hypogastric artery there is a umbilical artery, two umbilical artery which enter into the umbilical cord and into the placenta to get oxygenated. After birth there is a obliteration of this two hypogastric artery and foramen ovale and ductus venous. But ductus venous there is a remnant of umbilical vein. Okay, so it is the remnant. Ductus venous is the remnant of umbilical vein. It is called ligamentum teres in the liver. That's it. This is the fetal circulation.